Professor DeWin, you presented a study that showed that the amount of porn a man watches is linked to worse erectile function. Could you explain the study design in more details, please?
Yeah, sure. So we started with the fact that in my clinic, I work as an adolescent urologist. I see more and more young people coming in with erectile dysfunction, and our usual workup for them and the usual medication we give them doesn't work. And step by step, I started to see the link between erectile dysfunction and maybe porn, but I wasn't completely sure. And that's actually the reason why we set up this study. So actually, this study started with questionnaire about male sexual health, not telling people that this questionnaire was actually going to study porn. We did a huge questionnaire with 118 questions, asking about general health, asking about alcohol consumption, drug abuse, fitness shakes, things like that, but as well about porn watching, masturbation, and their quality of their sex life. The questionnaire itself consists of a lot of questions that we designed for them, but also it included several validated questionnaires, like the IIEF questionnaire that we use in general to rate erectile function or dysfunction. The male sexual health questionnaire was included, but we also included questionnaires about porn addiction, craving, and things like that. Then this questionnaire was put online and spread around. And after a little while, media picked it up, and then, I hope to have 1,000 participants. And after the media picked it up in at least 2 countries, our response rate increased enormously. So it became much bigger than actually we wanted it to be. The study we present, what we presented, the poster that we presented, that's our very early preliminary data. But actually, we show a trend line between the amount of porn consumption and the erectile function. And it's an inverse trend line, meaning that once porn consumption is going up, the IIEF score for partnered sex is going down. But as you can see in the curve as well, the correlation is not extremely strong. But the correlation is stronger in younger people below 35. But then we dig more into the data, and we put the people in categories depending on how much porn they watch on a week's time, and we do statistical analysis at that point, checking the porn consumption related to how many minutes they were watching. That put into categories. Then we clearly see that in the group below 35, watches 300 minutes porn a week, the erectile dysfunction is a bit more than 30% in that young group. And if you compare that, and that's statistically also significant, with the group that watches much less, and then less than 16 minutes a week, it's there we only have about 10% who have erectile dysfunction in that younger age group. But as I said, we didn't only use porn consumption. We didn't ask for how many minutes per week you are watching porn. I think if we all think about ourselves, it's very difficult to answer that question. But we asked about their frequency of masturbation. And on a scale of 10, from 10 times you masturbated, how often you needed porn to help you to get to your climax. And we asked also, like, if you're watching porn, on average, how many minutes are you watching? So this graph that shows us the minutes per week is actually a calculation we made based on those answers. But as I said, we also used a craving scale and a porn addiction scale. And if you look at the porn addiction scale, actually there, the correlation is much stronger. And if we check the people below 35 who have a high porn addiction score, 45% of them have erectile dysfunction. And yeah, that's dramatic. And the problem is that when people present to our practice with erectile dysfunction, we don't always ask about porn consumption. We often ask to check if the person really has a problem or not. We often ask like, okay, how are your erections when you're masturbating? And often these people will tell you that they are okay. But then if you ask the second question, like what happens when you masturbate without having porn, then sometimes you start seeing people that have to answer like, yeah, they are a bit less. And that's actually the risk group.
Is it also possible that younger men with erectile dysfunction rather choose porn over sex with a partner to avoid failure? Did you consider that?
Yeah, we definitely considered that, and then we dig much more deeply into the data. It's a fact that we also asked about being nervous to have sex and things like that. We also asked about if they preferred porn over real sex. We also asked if they had to watch more porn to get the same level of arousal. So to answer your question, we have to look at those different questions in our questionnaire. It's a bit more than 20% of our respondents who will tell that they have to watch more and more to get the same level of arousal to get an erection, which is important. We also checked about how nervous they were to have sex, and if their nervosity was one of the reasons that they couldn't get an erection. Yeah. And if we compare those two groups, and we compare them with the minutes per week they are watching and with the addiction score, it's much higher in this group. So yes, if they are nervous, they will have a higher addiction score as well. Yeah. And it's not just the minutes per week. If we check, and that's what we asked as well, we asked all those people about their erections during partnered sex, but we also about their erections when watching porn. And then you will see that those that scored low for the erections during partnered sex, about 60% of them didn't have a problem with their erections when they were watching porn. So this is not a randomized control study, which would be very interesting to do, like giving a lot of people a lot of porn and another group no porn, and then check what happens with their erections. It doesn't happen all of a sudden, but this kind of study is very difficult to do because it's very hard to find people who are never exposed to porn. It's only 1% in our data. So you can't make conclusions that one is causing the other, but at the other hand, the correlation, when we dig into the data and we look at the different statistical tests we have done, not just at the graph that I presented in the poster, it seems that there is a very relevant thing, and that we as urologists, when being confronted with a young person with erectile dysfunction, we definitely have to consider this.
So as a consequence of your results, what questions should urologists ask young men showing signs of erectile dysfunction?
Yeah. So at the moment, we are checking which are actually the best questions to ask. Because as I said, for minutes per week, it's not just that, and that's also difficult to answer, and that correlation was much weaker. There are people that watch like 2 hours a week and have a very high addiction score. And there are people that watch 300 minutes a week that have a lower addiction score. So it's not just that, but we have to check more about their addiction, and I think using certain addiction scales can be pretty interesting. At the moment, we are doing a study to evaluate which questions are actually the most relevant to ask. But one easy question everybody asks when somebody comes in with erectile dysfunction, everybody has learned at university that you have to ask how the questions are during masturbation. A very easy question to ask is, after that, and how are they when you're not watching porn? You can't ask a certain person directly about their porn consumption because they will be afraid. But by asking, like, how are your erections when you masturbate? And then secondly, by asking, how are they when you are not watching porn? Then the patient will see that you actually in your first question assumed already that he was watching porn, so he will feel less confronted than when you ask directly. And to be honest, I mean, if I see in our data, more than 99% is watching from time to time. So that's something to consider.
And thank you very much for the interview. Thank you.
No problem. Okay.